Capitol Hill to Wall Street. This is Politics and Profits with your host, Rick Amato.
Welcome, everybody. I'm Rick Amato. It's time for Politics and Profits.
We follow the trends on Capitol Hill that lead to the profits on Wall Street. We expose the hard facts of what your elected officials are doing when you're not looking. And we show you how you can profit from their politics. The American dream is alive and well, and you can be proud to call America your home. And now, it's Rick Amato.
Welcome to Politics and Profits, everyone. I'm Rick Amato. As we know, the COVID pandemic, I should say, has created a very uncertain, unhealthy in a lot of cases, and unstable environment across America. One of the industries which has been hit the hardest, perhaps, and does not get a lot of publicity, a lot of exposure, maybe I should say not enough as it should from the media, is the at-home care or in-home care industry. Of course, the elderly population is more susceptible to the COVID pandemic, and you would think that in-home care, at-home care would be more in the limelight. My next guest is in that industry, and she's on a mission to get her message in front of her state's governor. Let me welcome from the area of Naples and Fort Myers, Florida, the Vice President of BrightStar Care, which is an in-home care business. Let me welcome Susan Nimnuan. And Susan, I hope I pronounced your last name properly. Ron DeSantis, of course, doing a terrific job there in Florida, from what I can tell. You want to get a message in front of him, Susan. And that message is basically how COVID-19 has impacted the in-home care industry and your frustration with getting vaccines to senior citizens, as I understand it.
Yes, definitely. Seeing that our industry has been overlooked from the start of the pandemic, my mission is really to bring awareness and education to the significant role of home health. We support hospitals, long-term care facilities, skilled nursing, skilled rehab, as well as many patients in our community in their very own home setting. And throughout this pandemic, our industry has just been overlooked, and I'm really looking to end that and also focus on the COVID vaccine. There's been several hurdles through the pandemic, and we can talk about those more. But right now, my main focus is the vaccine.
All right, you've been featured a lot in local television there in Southern Florida, getting your message out. First time you've been on national TV. How has the vaccine? How has in-home care been overlooked? Are you saying that the vaccine is not getting to the patients in a timely manner, or low quantity? Exactly how?
So really, it starts at the beginning of the pandemic. Here in Florida, we have 4 million seniors, and over 350,000 of them benefit from in-home care. So that's a big part of the healthcare industry. It's a big part of the senior pie. And there's initiatives and emergency state orders and all these different things that have come down that trickle down from decision makers, and they're geared towards hospitals and long-term care facilities. And I understand that, and I support that, and I'm a huge advocate of the Seniors First initiative of the governor. There's an equal part of the pie here, which is in-home care, and nothing has included us. There's no guidelines. There's no resources. There's nothing. So, for example, at the start of the pandemic, personal protective equipment, PPE, right? We hear these letters all the time. And it was key to keeping our patients and our staff safe. And overnight, the price of PPE just skyrocketed. And there was this huge demand and a limited supply, or fear that supply would become limited. And we were able to overcome this hurdle. We have wonderful local suppliers we worked with, and we have a supply chain through our corporate office. So PPE was an enormous expense, For example, a box of gloves used to cost me $5 and now they cost closer to $20. But an expense worth taking 100% to keep our staff and our patients safe. But we weren't able to get any resources or support or anything from local or state or federal government or orders, any of that.
That, as someone who's not in the industry as you are, to me that sounds astounding. I mean, I can't believe it, given the age group of those who are involved in in-home care. Why do you suppose this is? As you said, long-term care, other sectors, they're fine. Why are you suppose that in-home care is just being overlooked?
I think honestly, it's a lack of understanding. I think it's I've been on this mission for a while now, trying to bring awareness, and I've met with and had conversations, I've exchanged emails, I've done Zoom calls, interviews, number of things. And I hear the same message kind of back to me. Well, they're in the home. Aren't they isolated? Aren't they safe? Well, what exposure do they have? And I want to say back to them, they have a huge risk. Your average home care patient lives with another family member or two, whether that's a spouse, an adult child, potentially a grandchild is in the home, a school-age child. You have people coming in and out of the home just in your immediate family. Now add on to that, there's groceries, there's meals. You have to go to doctor's appointments. And then you add in the home care. So you have a caregiver, a certified nursing assistant, for example. You potentially have a registered nurse coming in and providing medication management.
Okay, if I could jump in, and by the way, I'd like to point out to our viewers, you are an approved vaccine provider in the state of Florida. So it's been overlooked because the misperception is that since they're at home, the risk is not as great.
Yes, that is truthfully what I get back in the conversations I have. It's a lack of understanding what in-home care is and what the risk is.
What is the typical age of someone that's involved in in-home care?
My average age patient is 74.
All right, so we already know that above age 65, and as it gets older, that group is at greater risk. Should they have underlying conditions? Should they have some sort of illness? It would seem to me it doesn't matter where they are, in-home, out-home, doesn't matter. If they're in that age group, they should be a priority. Susan Nimnuan, we're about out of time. As we go to a break, any message you would like to have for the governor of Florida?
I've done the legwork. I got approved through Florida Shots to be the vaccine provider, and I just understand right now that the distribution comes directly from the governor's office, and I'm hoping to get his attention to understand that if he approves these vaccines, we can hit a huge number of seniors right in the comfort and safety of their own home, and our caregivers' voice will no longer be overlooked as well. They are frontline heroes as well.
All right, good message. Ron DeSantis is doing a terrific job in Florida. I know you feel that way as well. I'm sure he will be very sensitive to your message. Hopefully he sees this on television. If not, we're going to work and do what we can behind the scenes, Susan, to try and get this message in front of him on behalf of you.
Well, thank you so much. I appreciate the opportunity.
Thank you for joining us. You're doing a great job there in Florida with BrightStar Cure. Keep up the good work.
Thank you.
Broadcasting from the Liberatory CPA studios. Back with more after this.
Politics and Profits with Rick Amato is brought to you by Liberatory Accounting, the IRS problem solvers. To find out how Liberatory Accounting can help you, call 877-6-SOLVER. That's 877-6-SOLVER.